Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Good afternoon and welcome. I'm Wayne Callan, and you're listening to Attitude Magazine's weekly ADHD expert audio broadcast. Today's webinar is about how cognitive behavioral therapy can change your thoughts and, in the process, perhaps your life. We've all heard a lot about the benefits of CBT. The research community has done lots of studies on it, and the benefits are clear-cut and positive. ADHDers are in need of those benefits. Many of us get down on ourselves too easily, tend to have negative thoughts and pessimistic scenarios running through our heads, which prevent us from accomplishing what we set out to do. We're often glass half-empty types. Today, Dr. Russell Ramsay will give us perspective and approaches for using CBT to help us manage the everyday challenges of ADHD. Dr. Ramsay is co-founder and co-director of the University of Pennsylvania's Adult ADHD Treatment and Research Program and an associate professor of clinical psychology and in psychiatry in the University of Pennsylvania Perelman School of Medicine. So with that introduction, let me turn it over to Dr. Ramsay. Russ, thanks for being here.
Wayne, thank you so much. It's always a pleasure to be part of an Attitude webinar. So one of the ways to get started on this, talking about cognitive behavioral therapy, and it's a form of psychotherapy that emphasizes the interplay of cognitions, how we think about things, behaviors, what we do, and emotions, feelings. There's not enough room in the title, and emotions have been part of psychotherapy forever, but what was interesting about CBT is taking a look at the more immediate thoughts and behaviors. And as CBT, by us and by other groups, was adapted to adults with ADHD and how it can be helpful, one of the questions that arose, and one of the things I did with some of my slides for a little while, the question was whether CBT for adult ADHD should be lowercase c, uppercase b, or actually uppercase CBT, because it seemed like the behaviors, the coping strategies were the main things that we were trying to encourage. Use of the daily planner, trying not to procrastinate, and the cognition seemed to be more of a tertiary, issue. So in looking at the old view of cognitions for adults with ADHD, one thought was that thoughts really don't play a role in ADHD. Not that thoughts don't matter, but distorted thoughts, that we really didn't need the cognitive interventions. Also, another thought was negative or distorted thoughts are only relevant in cases of ADHD plus an anxiety or mood disorder diagnosis, because cognitive behavioral therapy for anxiety, depression, we really know the impact of the negative thoughts. Some would even say it's a causal role, but in cases of ADHD, that seemed to be the where the negative thoughts were limited to, and that changing behaviors is the main focus of CBT for adult ADHD. The new view that I'm going to be talking about today is that thoughts don't cause ADHD. You don't have ADHD because you negatively thought yourself into it, but the experience of growing up with ADHD, living with ADHD, particularly if it's gone undiagnosed, these experiences can produce or influence thinking and attitudes and behaviors, or beliefs, that can impact coping and therefore need to be addressed in treatment. There is some research showing a direct link between ADHD and negative thinking, and that thoughts do influence. There is a reality that changing behavior is a central focus of CBT, but that thoughts play a role in things like procrastination, the trust in a planner, things like that. And why is this important? So living with ADHD, how do we develop our attitudes? Well, one, there's a genetic predisposition for having ADHD, but then it's not like a direct line. Genetics play a big role, but then having ADHD affects your learning history, your interactions with the environment, both positive and negative. There might be supportive people who help you manage your ADHD better. You learn coping strategies, but a lot of people have a lot of experiences where they say, and I always go back when I'm talking about this to one of the early books about ADHD entitled, "You Mean I'm Not Stupid, Lazy, or Crazy?" They end up being the attributions that a lot of people learn. I keep waiting to the last minute to study for the exam. I must be lazy. I must be stupid. I must be crazy. And these are usually the conclusions, the beliefs that are arrived at, not understanding the impact of ADHD. So this learning history is really important. You know, the interaction of yourself and the environment, and how this can lead to selective attention, what we focus on, the evidence that we use to develop our sense of self, our belief about our abilities to do certain things, and that this selective attention can be biased in a way. In fact, Dr. Aaron Beck, the father of cognitive therapy, was recently updating his cognitive model of depression and elsewhere, and for the first time he was really talking about the impact of selective attention in the whole process. So these create the lenses through which you see the world, and these lenses can be colored in certain ways. We've heard the phrase seeing things through rose-colored lenses, where we see things in a positive light, but a lot of times the lenses can be darker or skewed in a way where we're not seeing things accurately. And this can affect what's called the cognitive triad, the view of yourself, the world or your environment around you, and your future. So why is attitude important? The importance is self-esteem, how you regard yourself. But as important as self-esteem, or more important, is self-efficacy, the ability to handle things, the use of your strengths, your capabilities, or even if you say, this is beyond me, to ask for help. You know, the ability to solve problems. There's adaptive optimism, being able to see options for handling something. Persistence versus learned helplessness. And the shift in thinking is trying to develop, when you're facing a problem, that this is situational. What is it about the environment that I can handle right now? This is short term. This will not last forever. I can get through it. And there may be a specific way through, as opposed to a pessimistic mindset where things are viewed as personal. This is my fault, and if I don't solve it, that means I'm a failure. Permanent, this is going to keep going on and happening again and again, and pervasive. This is going to affect everything. The importance of attitudes also is for staying engaged. And this could be, for me, a lot of times talking about adult ADHD, a main problem seems to be disengagement. For me, procrastination is disengagement. I know what I want to do, but I'm not doing it. Disorganization can be disengagement. We're trying to manage and organize what we want to do, but that gets in the way of actually doing it. There's also resilience, or persistence, or what Angela Duckworth called grit, being able to persist over time, doing things when you may not be in the mood to do them. And all these things come together, for me, at least, being able to have adaptive hopefulness. Having options, looking for the potential to grow, even growing from mistakes, emotional intelligence, and adaptive positive thinking. So let's start with the schema, or the core beliefs. These are the lenses through which you view the world, or what are your rules for the world? So later on, and what's more familiar with a lot of people in terms of cognitive behavioral therapy, is the notion of automatic thoughts, and we'll spend more time on those later. These are the answer to the question, what thought just went through your mind? When you procrastinated on mowing the lawn, when you thought about mowing the lawn, what thought went through your mind that got in the way of doing that? Oh, I don't feel like doing it, it's too hot. That's an automatic thought. Now, below the automatic thoughts, or one way to think about it, automatic thought is the weed, but the core belief is the root of the weed. Like I said, the rules for how the world works, the lens through which we see the world, and schema, these core beliefs, these reflect the natural human tendency to categorize experience in order to make sense of the environment. So we have a schema for driving the car. In the U.S., it would be driving on the right-hand side of the street. And that can be very adaptive. But if you do the same thing in the UK, it's not really adaptive. So beliefs can be adaptive or maladaptive. One belief may work well in one setting, but not another. Like I said, the driving schema. And when we're talking about other things, more emotional beliefs, it's associated with developmental and learning experiences. And they're strongly tied with emotional experiences. So one gentleman, or many people I work with ADHD, when they're talking about some of their negative thoughts and situations, will be able to think back about some time when they felt maybe very embarrassed in front of a class because they were called on to give an answer and they were daydreaming and their mind was somewhere else and they didn't even remember what class it was. And the other students laughed, and no other student that was there 20, 30 years later probably even remembers it. But the student who felt laughed at, that sits in there in terms of, a belief related to you never know when you're going to be caught out, or you never know when you're going to look like you're unprepared or a quote unquote failure. And no one thing will necessarily do that outside of some traumatic reactions or traumatic events, but you start stringing them together across years in school, across different classes. And that's, we find adults with ADHD can, not everybody, but can start to develop these negative lenses. And some of the common ones we see in ADHD are listed out here. The one I'll focus on is self-mistrust. I cannot rely on myself. Now, the mistrust schema, as it's typically reviewed in CBT, is mistrust of others. So somebody who's been abused will say, those who say they've got your best interests in mind hurt you the most. So there might be a mistrust of other people and their intentions. With ADHD, we see it as self-mistrust. I can't rely on myself. I studied as hard for the first test as I did for the second one, but the first test I got an A, the second one I failed. So I study hard, but I don't know what the results are going to be. And that can lead to sometimes going, well, why bother studying if I don't know, what the outcome's going to be? And I appreciate we're doing a flyover on some of these things. Compensatory strategies. These are not compensations, as you'll see in the adult ADHD literature. Like a compensation for ADHD might be setting up automatic monthly bill paying with your bank. That way you don't have to write a check every month. That's good coping. That's something you don't have to worry about. Compensatory strategies tied in with the core beliefs are similar to self-defeating behaviors. And even in more detail, these are attempts that at first seem like you're trying to cope with the negative beliefs, but they actually insidiously end up making them stronger. So one example I use a lot, a college student with ADHD feels like an imposter being at college. I don't belong here. I'm not as smart as people. I must have fooled the admissions committee. So when faced with a class or an assignment that activates this negative belief, I'm really not understanding. I got through calculus in high school, and I'm taking calculus again in my freshman year, but I'm having a hard time. It's making me nervous. I'm not getting it. As soon as she starts to feel like an imposter, she might have an opportunity to say, well, I've got to go to the club meeting for the campus newspaper, or a friend of mine really needs a shoulder to cry on, so I'm going to be there. I feel competent on the newspaper, or I can be a good friend. But then that takes away time from the studying, and then she does poorly on the calculus test and then says, well, see, I am an imposter because I didn't do well in this class, when in fact she escaped working on the calculus homework or studying by doing these other things where she felt more competent in. So it's just sort of how we can find ourselves in these repetitive patterns that seem to strengthen the beliefs, almost like a self-fulfilling prophecy. So some of the compensatory strategies that we see, and most of them seem to be within the theme of avoidance. Actually, avoidance or procrastination, not facing things or just delaying things time after time. There can be deflection, doing other things instead of what we should be doing, and these might be things that have to be done, but they're lower priority. Running out the clock, I'm just going to do things to waste time, get through the day, and not worry about this now. Or pseudo-efficiency. I'm busy, I'm doing a lot of things, but I'm not doing the things most central to what I need to get done. So I'm busy all day, but at the end of the day, I'm not feeling really productive. So these are all things that in the moment they get us through, but at the end they're ultimately strengthening the negative belief. And there's a couple other, being overcommitting, apologetic, and the line I have there, it was a patient I'm working with said she wishes, and a patient with adult ADHD, when we're talking about this, she said, I wish I could design a t-shirt that on the front says I'm sorry and on the back says thanks for understanding, because part of her belief is she feels like she's always making up for feeling like I'm sorry I'm late, I'm sorry I didn't get this to you when I should have, all those things, and then she feels indebted. And there can be the compensatory strategy of overcorrecting, overcompensating with strengths, like agreeing to do things like to stay late at work, using humor, and these might be other positive attributes, but they still don't address, some of the coping with ADHD issues and the negative beliefs underlying that. So just briefly, some of this will be my geek out slide, but there was a study actually looking at the schema and adult ADHD that's just been published not long ago, and they focused on 4 schema that we've written about and others have: the failure, I keep making mistakes; insufficient self-control or self-discipline; social exclusion, people will not like me; and defectiveness or shame, just I'm somehow flawed. And this was drawn from a non-clinical sample, adults not in treatment, and they did an ADHD rating scale, and 7.4% of the sample met criteria for ADHD. It wasn't a full evaluation. These are non-clinical adults. So they focused on a questionnaire for these schema among this 7.4% that had ADHD, or at least screened positive. So what they found was adult ADHD was strongly associated with these predicted schema. So the more symptoms of ADHD you endorsed, the more the greater degree of endorsement you had for these schema. And again, remember, this is a non-clinical group. They weren't in treatment. They may not have been formally diagnosed with ADHD. They just scored higher on this ADHD scale. And in addition to the schema connecting with ADHD symptom severity, these were also associated at the same time with high levels of stress and lower levels of emotional well-being. So ADHD is stressful to live with. You are more likely to develop a negative outlook, and then this over time impacts your emotional well-being. And I know I'm saying this for the third time, and this was in a non-clinical sample. So the symptoms interact with developmental experiences, interact with beliefs, which interact with overall well-being. So things that we've hypothesized before, but now we're getting more research support for the actual cognitive behavioral therapy model. Changing schema quickly, one way to do it is to capture what a negative thought you're having in the moment is. So if you're running late for work, okay, I'm always late for work. And later on, we'll see that that's all or nothing. Always, never are a good cue for all or nothing. But if you want to take a look at, well, what's my negative view underlying this, then asking the question as part of an exercise, well, if this thought is true, if I am always late for work, what does that mean about me? Or what does that say about me? Well, I'm unreliable. Well, if this is true, what does this mean about me? And you just keep going, asking that question until you get to the bottom. Well, other people are going to be fed up with me, and I'll end up alone because I can't handle things like other people can. And that's a lot to carry around. So that's where the automatic thought is the visible weed above ground. I'm always late for work. But if you find yourself getting really down or self-critical about yourself, asking these questions, that's how you might get to the root of the weed, saying, you know what, I just feel like I can't handle things and other people are going to leave me as a result. And there's different ways, we won't go into this, but there's different ways. You don't have to do a complete overhaul of your beliefs, but you can just understand them differently, understand situational variations. And also there's the fake it till you make it. You know what, I just can't believe this whole thing right now to get through this situation. I just have to focus on getting through right now and getting into the office and making it okay with the boss. But in working with this, part of the change is looking at new belief systems, and it doesn't have to be a positive belief, but something that's more balanced, enough that we can stay engaged in gathering new experiences, So the person who, the gentleman I mentioned before who said, I'm always late, well, then there could be the coping strategy of, well, let's work on your time management to make you late less often and try to reduce that as much as possible. And other examples of unreliability to see if we can actually change this a little bit and live into new experiences and new beliefs. So the automatic thoughts. So these are the thoughts, what thought just went through your mind, the things that we are having all the time walking around. So the automatic thought is the in-the-moment reflexive mental reaction to an event. It's what Freud would have described as the preconscious. It's sort of like the running play-by-play self-talk that we have in the back of our mind that we can notice if we pay attention to it. So what makes an automatic thought, what characterizes an automatic thought such that we want to pay attention to it? It's usually associated with a change in emotions or behaviors, such that you start feeling down, you're feeling anxious, you find yourself not doing something you had set out to do. That can be a signal that, all right, what thoughts, you might want to check in what thoughts going through your mind. And a first thought may be a trigger for another automatic thought. Just like that gentleman before with the lateness to work, I'm always late for work, and that can be a trigger for I'm unreliable. That can be a trigger for the boss is going to be angry with me, things like that. So an event that triggers a thought could be internal, like a memory. We just, our mind drifts and we think back to some frustrating situation or some regret, or it could be external. Like the boss sends back an email with a copy of the report you submitted saying, hey, there's some mistakes I'd like you to correct and resubmit. So an automatic thought can be self-talk, the boss is angry with me, or an image. You imagine yourself getting fired by your boss. Images, pictures in your head, the movie running in your head, that's a cognition, that's a thought too. Most thoughts are neutral or positive, but a distorted thought are those that somehow twist, slant, or ignore information and interfere with your perceived options, your coping, or your well-being. And negative thoughts can be accurate. I forgot to pay the bill, but the conclusion might be distorted. I'll never be organized. If I can't do this, I'll never be able to raise a child, whatever. And positive thoughts can be distorted. Gamblers are very positive thinkers, and there is a discussion about the positive bias in ADHD, overestimating one's ability to do something, or, I work best at the last minute, everything will be fine. Everything always works out. There may be some evidence that happens sometimes, but it may not be a very adaptive thought. And sometimes thoughts may reflect possible outcomes, statistically possible outcomes. So going back to the previous example from the previous slide, and we don't have to switch slides, but where the person has the thought about the boss sending corrections for the report, the boss is angry at me, that is possible, but we don't have enough information yet. You might be reading into the situation, mind reading. So conclusions can be arrived at without having access to all the information. So some of the common cognitive distortions, and these show up in other things like depression or anxiety, but how they also show up with ADHD. So that one is magnification and minimization. We inflate the negative possibilities and ignore the positives. What we see this a lot with procrastination. We magnify how difficult a task is going to be and how pointless it is, and minimize our ability to tolerate some discomfort and get started on it. Comparative thinking is another one we see with an adult ADHD. Judging yourself on how you size up against somebody else, because usually it's an unfair comparison. You'll look at somebody else who doesn't seem to use a daily planner and say, well, something's wrong with me because I have to work so hard scheduling out my day, and my friend in the office seems to not have to schedule as much. They seem to be able to remember their meetings throughout the day. And one more, selective abstraction. Filtering info to support your outlook. That is the 3 + 3 = 7. And what that means is it doesn't matter what's on the left of the equation, you arrive at the conclusion, the number 7. So if you're disorganized, you will ignore times that you did remember things, that you used your planner, and only focus on your mistakes that week and say, see, I'm still disorganized, medications aren't helping, CBT isn't helping. You could think about this as spoiled cherry picking. You only look at the bad cherries. So again, pardon the geek out slide, but recent research challenging the notion that negative thoughts are not associated with ADHD, and we'll go through this quickly so we can get to the more takeaways. But the first study found that cognitive distortions in adults with ADHD are associated with both diagnosable major depression as well as subthreshold symptoms of depression and cognitive avoidant coping strategies, just not thinking about things or procrastination. And the explanation for this seems to go back to the CBT conceptualization of ADHD, that growing up with ADHD, particularly if it's unrecognized and untreated, makes it more likely there will be frustrating experiences, that this starts to create the negative belief or the negative mindset, and then that in turn makes people more likely to avoid things, which is going to cause more problems, which seems to strengthen the belief, sort of this downward spiral. The second study took a look at comparing adults with ADHD. One group had depression, the other group had no depression, and comparing them with adults without ADHD at all. Now, no surprise, the group with adult ADHD and depression had more and more severe cognitive distortions than the other two groups. However, what was interesting, the group with ADHD without depression, although having fewer and less severe cognitive distortions than the depressed ADHD group, had greater numbers than the control group. And so that gave counter evidence to the notion of ADHD by itself is not associated with cognitive distortions. It actually is. Then the last study, Tarenta et al., that found that distortions were associated with high emotions and high escape avoidant coping. So this talks about the cognitive piece, the distortions tying in with the emotionality, the emotional regulation difficulties, and then that leads to being more likely to be disengaged with things, which we know causes problems. The Abramovich study number 4, found ADHD compared with non-ADHD controls had a lot more intrusive/worrisome thoughts. So thoughts that would pop in that would be associated with worry or anxiety. And what was noticeable about them, that adults with ADHD had these more frequently than controls, than people without ADHD, and it was harder to get rid of them. They were sticky. So the negative thoughts were actually sticky, and it was harder to distract from them, which would be something we would see in procrastination. It's hard to deal with the negative thoughts about studying, doing income taxes, and put them to the side long enough to get engaged, but that's some of the work of CBT. Then the study number 5 there, it was our group that when you control for depression or anxiety, there was a positive, low, but direct correlation between ADHD and distorted thoughts. And there's just been a recent dissertation from our group, and we're going to prepare it for publication, that severity of adult ADHD and the connection with low self-concept, that actually the distorted thoughts might be the link between those two. That's sort of a coming attractions. And this is just the geek out statistical slide from our study showing the 0.487. Actually, it's almost a moderate correlation, but not quite. But so just to show the direct correlation between ADHD and cognitive distortions. And what was most interesting out of this study was that perfectionism emerged as the most common cognitive distortion. Now, the thing about ADHD perfectionism, because when we think about perfectionism, and this goes beyond the study data, but we're hypothesizing that for the most part, ADHD perfectionism is front-end perfectionism. So that's the thought before you start a task, that you have to be in the right mood, circumstances have to be right, I have to have at least an hour to work on it because I can't get anything done in less than an hour, and all these things that have to be just right before getting started. And it's very rare that you're going to have all those things. And I know this is an all or nothing thought, but people are never in the mood to do homework, housework, yard work, income taxes. We may do them, but it's usually out of exclusion. Well, there's nothing else to do right now. I might as well do this now. It's not that we're looking forward to it. Back-end perfectionism that would be difficulties finishing, letting go of a task, trying to get it optimized. And usually we think about this with people, type A personality, perfectionists, but actually there can be an ADHD back-end perfectionism. It can come with a hyper-focused perseveration, and also something I'm seeing more, I'm still quibbling on what I'm going to call it, but perfectionism with interest. The thought that, and working with a college student, she was granted an extension on a project, on a paper. And she said she was having a hard time completing it because she was given a 2-week extension, it had to be 2 weeks better than everybody else's, that she had to somehow earn the extra time. And part of the reframe is, well, just because you had an extension doesn't mean you have to come up with an even higher quality work. You still just have to meet the class requirements. But it's like one of these, it's probably a shame-based, guilt-based reaction a lot of adults with ADHD have, saying, I really have to earn this, or, pay it back somehow. Somehow I'm accruing interest or accruing debt that I have to pay down. So changing distorted thoughts. There's a lot of different ways to do it, but one metaphor we like is if you think about the negative thought as a prosecuting attorney making a case against a task, against you, if it's a low self-esteem thought, I'm not a good person, I'm disorganized, I mess up all the time. What happens is usually the conclusion is based on it's like a one-sided legal case. Only the prosecuting attorney, the negative attorney, provides evidence. And as a way to think through, just even going through the exercise of how to change a distorted thought, thinking about, well, what would a defense attorney say on my behalf? Still bound by the evidence, but even going through the exercise of making a defense attorney's case. So what argument would your defense attorney make? Yes, John was late to work today, but he had his son on time for soccer practice this week, handed in bills this time. So, Your Honor, yes, this is something he has to work on, but we object to the all or nothing thinking by the prosecuting attorney. So that's also challenging the evidence. So it might be a fact that John arrived late at work that day, and that he's maybe been late 5 times this month. But then it's expanding the argument beyond that to look at other examples of timeliness that are just as valid. So challenging the evidence. And also in executive functioning terms, we're talking about prolongation of the moment or the reaction or impulse control. Rather than jumping to one conclusion, reviewing the evidence and coming up with a fair statement. Okay, I'm on time I was late today. I've been late several times this month, but it was better than last month, and I want to try to be late even less next month. Again, not the power of positive thinking, but adaptive thinking. And this also, the thinking this through allows us to face and manage the discomfort to come to a more balanced conclusion, and hopefully also a more hopeful one, that it also acknowledges our strengths and looking at and also acknowledging what behavior do I still need to work on my own, in CBT, wherever else. So some other questions to ask. What is the evidence that the thought is true or not true? If a friend of mine, especially one with ADHD, had this thought about this situation, what would I tell him or her? That's perspective taking. A lot of times we're a lot more forgiving with other people than we are with ourselves. What distortions am I using? Is there another way to look at it? What could be the effect of changing my outlook? Are there steps I can take to change the situation, problem solving? And can I accept this situation? And how will I view it in an hour, a week from now? Yes, I was late today, but once I get into the office, start doing work, will it be as important at the end of the day as it was at the beginning of the day? Still something you might want to pay attention to, but will it be as big as when you're walking into the office 10 or 15 minutes late? And these are things I've covered, in terms of in other webinars on procrastination, but it's a cognitive intervention in a way, how we define tasks that we want to do. I'm procrastinating and cleaning up the kitchen. Well, that might be too big and broad. If we focus on, well, rather than organizing the whole kitchen, can I unload the dishwasher, or at least the top rack of the dishwasher, making it a more achievable outcome. And that's a change in thinking insofar as it's how we think about the situation. And all these things, like just follow from that? What's the smallest first step? How we think about what we're doing. And if we're having a hard time following through, we're probably, we're thinking about it too broadly and vaguely, and that we can always divide it in half or somehow get it smaller so it's more doable. All right. So that was the whirlwind trip through your thinking processes. I probably didn't give you enough time to have thoughts on it. But just a quick summary. So it's encouraging that recent research is supporting not just cognitive behavioral therapy as a whole treatment package that we know, but also seeing that this very individualistic, personalized view, how we think about things. And the impact that has, one, how that stems from living with ADHD, and it also speaks to why ADHD is so important to address, because it affects all the things that are important for us. Not that you have to get a straight A average or everything, your kitchen has to be organized at the end of the day, but usually stuff that we want to do. This could be an art project, following through on a sport, exercise, other things that we want to do, the things from which we derive our sense of self. And that, one, how we're thinking about what we're doing, it's a nice entry point in figuring out, all right, what thoughts going through my mind? What do I want to be doing right now? Why am I not doing what I set out to do? And that, changing these thoughts, hey, just having a more positive thought or more adaptive thought, that doesn't get homework done, but it can be a first step. And also how we think about ourselves. We can give ourselves credit for the changes we're making, what we are doing, and develop hopefulness so that we can keep moving in, moving in the direction we want to go in.
Several people have asked, how can you break the link between self-esteem and occasional failures? A couple of people brought up the fact that they sort of cling to their failures rather than celebrating some of their successes, and their self-esteem sort of takes a hit. So does CBT help with that?
Yeah, I mean, one thing you can do, and I shouldn't say it this way, but I will, because it sounds like I'm apologizing, but it's one of these things. So I say this sounds like psychotherapy 101, but that I think it is important, just like it's important in dealing with ADHD to actually write down your to-do list, write down your plans so you don't forget them. And this would be something that's recommended for individuals with depression who don't have ADHD, but it is, and it's something that you can use the daily planner for too. It's looking back on what you've achieved in a day. So going back, and you can see the meetings you missed, lateness for work, but it's also the things that are on your to-do list. It's also a document of what you have achieved. And so I think it's important to catalog those things on a daily basis or however frequently, to give yourself credit for them. And it is important to catalog the setbacks as well, but not as much for the purpose of, well, see how I'm still not doing well. It's for understanding, making the failures, turning them into behaviors. What did I not do? So the example of John who showed up late at work, making it into, let me reverse engineer and find out what led me to be late for work. Tell you what, and sometimes it might be for John that he said, there's an overturned tractor trailer on the highway and I was on time. I was heading to be 20 minutes early, but this made me 10 minutes late. That I don't care whether you have ADHD or not, you're not getting around that truck. And also we could make some unrealistic plan like, well, I have to leave 2 hours early for work just in case that happens. It might not even be an ADHD problem. And if it is, okay, I tried to check my email once more before I left the house and I lost track of time. These are correctable behaviors. And one other reframe is, ADHD or not, we all get our daily allotments of mistakes, screw-ups, whatever we want to call them. And what happens is, I think adults with ADHD, because there can be a long history of saying, I've had more than my fair share, but even as they're working on it, there might be days that you go, yeah, I made a couple mistakes today, but this is like 1, 2, 3, or 4. And these were not necessarily, they might have been oversights. They might have been ADHD related, but people without ADHD are going to have probably, a couple at least each day or each week. So it's sort of knowing when do these rise above a threshold, and you pay attention to them, but it is part of the ongoing breaking the connection with the self-esteem or how you define yourself, and also looking for other things that you do well. Hey, I was a good listener for my child who wasn't happy with the score she got on a math test, or I was on time. I was on time for the train, whatever the case may be. So it is cataloging and handwriting. What were the things I did well today? And one of the thoughts you have to be careful for, and it goes back to that selective abstraction, or another way to say it would be the filter, that you minimize those. Well, it's easy getting there for the train, or the train was running late. The train may have been running late, but you got there in sufficient time, and other people might have missed the train. But it's easy to come up with excuses for why the successes don't count and ultimately the failures count. That can be a distortion too. So being mindful about how the distortions even subtly can sneak in. And again, this isn't power of positive thinking. Everything's fine. Recognize the mistakes, but making them behavioral and actionable. These are not like blemishes on your record or something like that.
That's a great answer. Several people have asked, how long does it take for CBT to work? How long do sessions last? A little housekeeping here. Are people in sessions for years?
Yeah. I'll start smaller. The sessions can really last. There's no hard, fast rule. Typically, most clinicians, most psychotherapists will keep to roughly 1 hour meetings. Generally 50 or 55 minutes. That way we can go to the bathroom in between and stuff like that. But there's nothing that says, I have people who might come in for periodic boosters, who they might just come in for a 30-minute check-in session, or people who might come from some distance where we'll do a double session, like a 90-minute session. So the individual sessions might depend. How long does it take? I mean, people can sometimes, like in the first meetings and working with adult ADHD, we really try to have success experiences right out of the box. Now, usually the first session might be something like dealing with a task somebody's procrastinating on, or maybe instituting a daily planner or a to-do list. But the thoughts come up all over the place. The thought about doing a to-do list, I've tried this before and it doesn't work. The planner, I won't check it. And these are all things that can be challenged. So the cognitive piece is woven in to pretty much everything we do. So hopefully there's some success experiences right out of the box. In terms of what would be an adequate dose of ADHD, I've had people after 6, 7, 8 sessions say, I think I got out of this what I need. But generally with our program and others, the research would say probably about 16 to 20 sessions spread out over about 6 months. So it doesn't have to be every week, but that would be roughly a full dose of ADHD. Now, some people decide this, and that might be adequate for a lot of people. Some people might decide to continue on for longer, either regular sessions or moving to like booster sessions like every month or something like that, just to stay on top of it. So really everybody's different. The question about is, at some point, are people done? Well, it's sort of like coping with ADHD. Yes, people are done, but it's not a passive done, like you finish your antibiotics and you don't have to take them anymore. Part of when cognitive behavioral therapy was developed as a treatment for a psychotherapy for depression, one of the appealing facts about it, and this has been borne out in the research, is the goal is to make the cognitive behavioral therapist obsolete. That these skills, dealing with your negative thoughts, the behaviors, things like that, these are things that anybody can institute once you understand them and once you use them. So one of the things with comparing cognitive therapy for depression and antidepressant medications, they found at the end of treatment, cognitive therapy was getting about the same results as depression, but when you would stop your medications, people would be more likely for the depression to return. When people stopped cognitive therapy, the gains seemed to persist because they could still use their defense attorney, they could use thought records, or just, hey, what thought went through my mind? I'm doing all or nothing thinking. That these skills would be helpful whether you're seeing a therapist or not. Now with ADHD, the management of ADHD is another variable that it does take more persistent coping to manage. But again, people get to the point where the coping strategies become more habitual in addition to the cognitive strategies. And so that I think some of the recent work by Steve Safran, I think Mary Salanto's group had this too. The follow-up studies say that people, after they stop cognitive behavioral therapy for adult ADHD, that the gains typically persist. But everybody's different. Some people might want to come back, or there's a change in life. Somebody has a child and now they're a parent, or their job changes, or there's some life change that they want to come back for a couple booster refresher sessions just to manage some new events in their life.
Mm-hmm. Actually, loads of questions about how do I find a therapist near me specializing in CBT. Lots of people asking.
Yeah, that's the rub, because there's a lot of good cognitive behavioral therapists. And I would also make the case that if they are willing, there's a lot of good cognitive behavioral therapy professional manuals out there. Steve Safran's Mastering Your Adult ADHD, Mary Salanto's Cognitive Behavioral Therapy for Adult ADHD, Tony Rostein and my Cognitive Behavioral Therapy for Adult ADHD. I know the titles aren't very original. I'm trying to Ari Tuckman's Integrative Treatment for Adult ADHD. It's not exactly die-in-the-wool cognitive behavioral therapy, but there's a lot of overlap with it. A proficient cognitive behavioral therapist could probably pretty easily integrate that into treatment. In terms of somebody who has the combination of CBT and adult ADHD, you can check on the CHAD website and the I forget the other one, the one with the professional resources. But
ADA?
Well, ADA, the Attention Deficit Disorder Association. But there's another thing within CHAD. It's sort of like a companion of CHAD where they have the help resources. I forget. Mm-hmm. Yeah, Help for ADHD, maybe it is, or something. That it has like all the ADHD clinics where they might have it. The Attention Deficit Disorder Association, you can look at in there, find help. And APSARD, the American Professional Society of ADHD and Related Disorders. They have a website up where they have a listing of all the ADHD centers that are out there. So even if you can't find somebody, or that a center's not close to you, you might be able to contact them and sort of do a 6 degrees of separation to find somebody closer by. You can send me an email, and if I know somebody I can pass along, we have a referral list we keep here of people. So there's different ways to fashion it together.
Mm-hmm. Is CBT more productive when a patient is also on medication?
Short answer is yeah. I know in the outcome studies on CBT for adult ADHD, it's about half and half patients who are on medications versus off when they did the CBT. And there was no differences in the outcomes. Now, this doesn't mean throw away your medications. What that says is there might have been people with milder symptoms of ADHD, less difficulties, who didn't need medications, and the ones who took medications had more severe symptoms. Mm-hmm. We had a very small study of like 5 patients who came through our program for our study who declined medications, and they fit that bill of mild circumscribed symptoms, generally pretty well functioning, and they did well with CBT alone. But the short answer is, yeah, the combination seems to be ideal, that the medications seem to relieve symptoms, and then the CBT can get in the work of changing thoughts, changing behaviors, and using the coping strategies.
Mm-hmm. How does CBT differ from coaching?
Dave Gawork and I are going to be doing a whole session on this at CHAD, and it's an interesting question, and it's a tough one to get through. Main difference. Well, no. I can give the main bullet points for me as a psychologist. A coach might have a coach might have a different answer. CBT is generally carried out by a licensed mental health clinician, and if somebody's credentialed in CBT, like some of the exercises that I went through very quickly about cognitions, behavior change, dealing with comorbid depression and anxiety. They've gotten full training and licensing in all those things, and this could be graduate school, postdoctoral fellowships, which are like a year. Yeah, there's predoctoral. There's just tons of clinical and supervised training, and it's a skill set. So I know there's self-help books out there about like feeling good, CBT, cognitive therapy for depression. There's a lot of takeaways that people can do on their own, but there is a craft to it. Now, there's a lot of overlap between CBT and coaching in terms of the actual coping skills for managing ADHD. So that's where there's been a lot of similarities. So there's sort of the question about where's the line in between of where coaching ends and CBT picks up. But the main differences are people credentialed for CBT can also deal with the more complex cases, and not that coaches aren't dealing with some complex cases, but in terms of where there's also depression, anxiety, substance use history, and a lot of times CBT can work well combined with coaching. Because sometimes people, once they've done CBT, or even instead of CBT, not everybody needs the whole gamut of everything that they're saying, I just need help with the coping skills, and there are some cognitions related to getting started or the belief in their ability to use the coping skills, that just focusing on the coaching / behavioral interventions can be enough to change thoughts as well. Mm-hmm. Yeah, no, it's a great question, but this would be probably a article length. No, but it's a great question. It's a great question. We're still trying to figure it out.
How does CBT help with co-occurring conditions like depression and anxiety?
Because CBT was there for those things first. So that's something that anybody versed in CBT is probably able, because depression and anxiety are like the common cold in the common cold to medical practice is what depression and anxiety are to psychology and psychiatry. Not minimizing those things, not saying they're easy, because depression can be associated with suicidal thoughts, and we know there's an increased risk for suicidal ideation and actually suicide attempts among very complex cases of adult ADHD, usually with depression and a substance use problem. But there's a lot out there, and people are pretty well trained in managing the depression and anxiety. So it's pretty easy to weave that in to a treatment for adult ADHD. And in fact, a treatment for depression is behavioral activation, getting engaged in behaviors, because when you're depressed, you're less likely to feel like doing a lot of things, so you do less, which makes you more depressed. Just dealing with procrastination in adult ADHD, it's sort of a 2-for-1. You're not procrastinating as much, and by definition, then you're engaging in behavioral activation, hopefully with activities that increase the likelihood that they'll boost your mood up a bit as well. So it's easy to integrate the two, and it's very common as well.
Can you do CBT at home? I mean, can you take those skills? Let's say you've been in sessions for 6 months, as you suggested. Yeah. I mean, that's the goal, right? Eventually,
right? No, it is. It's there are things that you can do on your own. Like I said, there's a lot of good self-help books on adult ADHD. There's some things like we have our patient guidebook, the Adult ADHD Toolkit, which sort of follows, it's sort of what we do in CBT, but delivered in a more user-friendly way. Steve Safran, he has the Mastering Your Adult ADHD. There's both a therapist guidebook, but also the patient workbook. Mary Salanto's book is excellent and very accessible in terms of being able to get in there and do it on your own. We're not talking like you're trying to take out your appendix by yourself, but that said, there are things like if you're having suicidal thoughts, if you're terribly depressed, substance use problems, or just a level of ADHD where you go, you know what, just using a colloquial, throwing a book at it isn't enough. And wait, I'm sorry, you've heard me say this probably every webinar. Most people that come into us will say, you know what, I know exactly what I need to do, but I just don't do it. So, that's part of what CBT, at least what we describe about our approach, we say, how we can help you is help you figure out how you don't do things, understand ADHD, the executive functions, all the motivational deficits, and then we can turn managing ADHD, which is sort of like I'm going to organize my whole kitchen, we turn it into managing pivot points. All right. When you're procrastinating, when you're not doing the task, what are your thoughts about the task? How are you thinking yourself out of it? What are your emotions about a task? I don't want to do this. And what are your escape behaviors? Okay, when I start, going to do something else, when I go to organize my DVDs or organize my computer, that's when I know I'm actually convincing, I'm escaping, I'm procrastinating on, organizing the kitchen. That's doing CBT.
Right.
So it's stuff that you can do on your own.
That was a great presentation. Really, really grateful for that, as I can see many of the participants are.
And I can tell the dog liked it too.
Yes, that's our office dog. Yes.
No, good for you. Good for you. I'm all for it.
So you did a wonderful job on that and putting a lot of complicated stuff in perspective. Also, one other thing, are there any apps? We just suddenly got a request for, are there any apps that you
know
might
what, there's always an app. There's always an app. And no, and I don't mean that in a bad way. There's a lot of CBT apps, and they're really good, generic, not necessarily just for adult ADHD. With all these things, it's like a planner or a to-do list. The devil's in the doing them. There's a lot that will work. And so there's no one, I can't even keep up with them all, but usually variations of a theme, tracking your thoughts, writing them down, challenging them, some of the things we talked about already. So any of them is probably fine. It's just, what will you use consistently?
Right. Well, thanks again, Russ. I really appreciate it.
My pleasure.
So everyone have a good day, and thanks for listening.
For more Attitude Podcast and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.